Welcome to the Common Chemicals in Healthcare and their corresponding safety data sheets training for human potential healthcare staffing employees. The Occupational Safety and Health Administration, also known as OSHA, revised their hazard communication standard to align with the International Global Harmonized System of Classifications and Labeling of Chemicals, commonly referred to the GHS system, back in 2012, and gave manufacturers and distributors until 2015 to become standardized. This was done for your safety since you are exposed to various hazardous chemicals and products in your work life. Some of those are reflected here on the slide. You have a right to know what they are, how to protect yourself adequately, the category of hazards, as well as other information found on those safety data sheets. This also helps companies review and determine if they need to swap out chemicals and products currently in use for safer alternatives, not to mention updating the personal protective equipment they provide to you for use. So as we mentioned, the hazard communication standard is to make sure that all chemicals are communicated to employers and employees in order to protect workers against chemical illnesses and injuries. A hazardous chemical is defined as any chemical which can cause physical or health hazards. The hazard communication standard is based on a simple concept that employees have both a need and a right to know and understand the hazards and identities of the chemicals they are exposed to when working. They also need to know what protective measures are available to prevent adverse effects from occurring. The HCS is designed to provide employees with information they need. Chemicals that are considered to be health hazards will fall into one of the following categories, including reproductive toxins, corrosives, neurotoxins, and carcinogens. You have a right to know what health hazards you are being exposed to anytime you use a chemical. Now please note, some chemicals will not be considered hazardous to your health and therefore will not have a specific category listed. Physical hazards can be caused by one of the 6 listed here on the slide, including compressed gases, explosives, and flammables. As mentioned, under the hazard communication standard, they have a revised globally harmonized system. The major changes to the GHS are hazard classifications, which is going to provide specific criteria for classification of health and physical hazards, as well as classification of mixtures, labels that are easily able to be identified with a signal word, pictogram, and hazard statement for each hazard class and category. These are going to be precautionary statements as well. The safety data sheets, formerly known as Material Safety Data Sheets or MSDS, are now just safety data sheets, and they have to have 16 sections to be compliant. And then information and training are required starting from December of 2013 forward. Anytime that a new chemical is introduced into your workplace, you also have to receive training on that. Container labels display mandatory information, including a product identifier that is the same as what is appearing on the corresponding safety data sheet. Container labels have standardized signal words, hazard statements, and precautionary statements to help ensure you are alerted to applicable dangers and necessary safeguards you should follow when working with that product. All container labels will also display one or more of the 9 specific pictograms, which are icons that appear in small red boxes that will help you quickly identify their specific hazard or hazards associated with the product you are using. We're now going to cover an overview of the 16 sections that make up the new safety data sheets in the order in which they must now appear. The blue sections are the ones that will give you the information you need more frequently: how to use, what PPEs are needed, and what to do if you're exposed or you ingest it, what first aid measures you need. You can overview most of the sections, but really pay attention to the ones in blue for your everyday use. You have section 1, which is the identification. It's going to name the product. Sometimes we use a common chemical name, and it's going to be different than the listed products, such as sodium hypochlorite is known to us as bleach, right? So we want to make sure that when we're looking at a safety data sheet, if we're using a common name, that we write it at the top in the margin, typically in the right top margin, just because it's going to make it easier for someone in the event of a first aid measure to know that if you say, oh, I got bleach in my eye, what do I need to do? They can flip to the bleach, because we're not going to call it normally sodium hypochlorite. Number 2, it's going to be the hazard classification, those signal words we talked about, hazard statements, precautionary statements, and the pictograms that will need to be on the container label. Also, this is going to be great if the container label starts to deteriorate or is missing and you have to put a secondary label on. This is going to help you get the information that you're going to need for most of that. And section 3 is going to be the composition or information on the ingredients. Here you're going to find the name of each hazardous chemical present in the product, including the percentages for each chemical if the product is a mixture. Section 4 is going to be your first aid measure, what initial care you should be giving by untrained responders, also what you need to do for the event of inhalation or skin and eye contact, and if you accidentally ingest it. There will also be information about the most prominent symptoms or effects that are acute or delayed, along with recommendations for immediate medical care. Section 5 is going to be the firefighting measures in case you need to have specific equipment for extinguishing the fire, or if you need to have a certain type of fire extinguisher. This information will be in Section 5. And then Section 6 is going to be any accidental release measures, recommendations on the appropriate response to spills and leaks and accidental releases. Section 7 is going to be the handling and storage. It's going to provide us the guidance on safe handling practices and safe storage. Some of the products that we use in healthcare settings cannot be stored outside or exposed to high heat. So we really need to be very cautious of this. And even if we're utilizing central supply, or our maintenance teams are the ones supplying those chemicals to us at our host facilities, we need to make sure that they know how to properly store as well. Section 8 is going to be exposure controls and personal protection. It's going to tell you the permissible exposure limits, also known as PELs, for that chemical, meaning how long can you be around or using it. Suitable engineering controls, such as a ventilation system, and then recommended personal protective equipment for workers to help prevent exposure. Section 9 is going to be the physical and chemical properties, including if it's giving off enough vapors to ignite and burn, the vapor density, if they're lighter or heavier than air, and a whole lot more information. Section 10 is going to be stability and reactivity. It's going to discuss whether the chemical is stable or unstable under normal ambient temperatures and conditions while in storage. So again, this is another section that our central supply or our maintenance teams, even our distributors, need to really pay attention to. Section 11 is really going to give us the information on what type of health effects, if any, of an overexposure to the chemical, as well as information about known or likely routes of exposure through inhalation, ingestion, skin and eye contact, and then a description of any symptoms of overexposure. This one is really important because in healthcare, we tend to use some pretty toxic chemicals, such as those for chemotherapy and cold sterilization. So you really want to make sure that you are reading this section because some exposure to those, just inhaling the vapors, could cause reproductive or other organ issues. So it's really important to pay attention here as well. Now, section 12 through 15 are not regulated by OSHA. So typically in American-based chemicals, you're not going to see a lot of information here unless they're also utilizing those chemicals in other countries. Section 16 will have some other information such as the date of the preparation or the last revision. Sometimes you will also see pictograms in section 16, where in earlier 2012 and 2013 and 2014, in the first section that they talked about, section 2, where you would see some of those information, they didn't necessarily put the pictograms, but they did put it then in section 16 while everyone was trying to figure things out. One of the main items that all of us will use, no matter which host facility we're at, is going to be that isopropyl alcohol or 70% alcohol. I wanted to take the time to really go into details here with you on some slides. We'll go into other chemicals that you could be exposed to as well, but this one is one I wanted to cover first because we're all exposed to it. And so this really gives a nice outline. You're going to have who the distributor is, who the manufacturer is. It's going to tell you their product identifier, any other products that go along with it from this particular supplier. Section 2 here is a little shocking to some people. They did not realize that isopropyl alcohol that we use every day for cleaning instruments and utilizing it to clean skin areas, prep, and things like that is actually an acute toxicity for the dermal and oral. It can cause eye damage and irritation. It's very flammable. A lot of people knew that. And then it can also cause some sensitization. So you want to be very careful. Now the signal word is a warning, and the pictograms you'll see is the exclamation point and the flame over the line. The hazard statements here are going to be that they cause eye irritation, it's flammable, the liquid and the vapors. It can be harmful if swallowed, may be harmful if it's in contact with the skin, and may cause an allergic skin reaction. A lot of people don't realize that, and so they think it's okay to use this product without wearing their required PPEs. It talks about some precautionary statements and call poison center or the doctor if you feel unwell, what to do for eye irritation that persists, rinse it out, obviously, contact a medical professional, rinse and wash your skin if it's on your skin. They also tell you to not inhale it. It can cause dizziness and drowsiness. They tell you if your work clothing is contaminated, you need to change out your clothes. You want to make sure that you're taking precautionary measures and that you are closing the container tightly. You want to prevent against any static discharge. You want to make sure you're using the proper container. A lot of the times we buy gallon-sized bottles of alcohol and we put it in glass jars or plastic jars with cotton balls or cotton swabs so that we can easily, utilize it quickly. Make sure that you're putting it in an appropriate jar that's not going to cause any sparks or eat through, things along those lines, spilling, such like that. It does tell you to wear protective gloves and wear protective eye protection and face protection when utilizing this product. It also says to store it in a well-ventilated place and dispose of the contents in accordance with the federal, state, and local environmental control laws. Moving on to section 3, we can see there's just one ingredient. no mixtures, which is nice. Then we have section 4, our first aid measures. So we want to make sure, again, I always recommend, if possible, to highlight section 4 just to make things easier, but it's not required. But you do need to know section 4 is where you need to go in the event that somebody has an exposure. If they have got it in their eye, you want to make sure that you're using your eye wash kits and flushing your eyes for at least 15 minutes. Remove contact lenses if worn, and then seek medical attention if irritation persists. If they inhale it, you want to move the victim to fresh air. If they swallow it, you want to call a physician. You want to rinse their mouth and throat thoroughly with water, and do not induce vomiting. This is where you're going to find if a chemical is saying induce it or do not induce it, and you make sure you're following that through. You want to keep the head below the hips to prevent aspiration of liquid into lungs if vomiting does start. Now with firefighting measures, it does tell you you can use a water spray or carbon dioxide, a foam, or a dry chemical. So if you are going to grab a fire extinguisher, make sure you have one that covers all of this. Typically in healthcare facilities, you're going to see an ABCD or just an ABC, and those are more universal for use. In section 6, we talk about how to handle a small spill or a large spill. Then we talk about handling and storage. Again, this is where your central supply or maintenance teams need to know what to do for handling and storing. Then we have section 8, our exposure controls and personal protective equipment that's required. So again, they're wanting you to wear goggles and gloves when you're utilizing isopropyl alcohol. Again, several people utilize the cotton-soaked swabs and cotton balls and things along those lines that are soaked with isopropyl alcohol, and they don't always think about grabbing gloves or eye protection. So please make sure you're following what is required.
Right, so now we're going to move on to other products that you can come in contact with. I would tell you, just because we're utilizing these specific manufacturers versions, please make sure you still are checking the SDSs for the products you're using at your host facilities, because I will tell you, after seeing several different manufacturers versions of 70% isopropyl alcohol, they have different ratings for the different manufacturers. So you definitely want to make sure you're paying attention to what your exposure level is. So now we're going to talk about hydrogen peroxide, because this is another one that several of us will have in contact in our different host facilities while in healthcare. I will talk about the highlighted areas that are really areas that you should pay attention to besides the overall. We talked about section 2, section 4, section 8, and section 11 earlier, so I'll spend a little bit more time on those. So hydrogen peroxide 3% is the topical solution. This one is a liquid form only, and it does show that it's a category 2 for skin corrosion irritation, and then a category 2A for eye damage and irritation. The signal word is warning, and it does have the exclamation because it does cause skin irritation and serious eye irritation. They tell you to wash your face and hands and any exposed skin thoroughly after handling, and wear protective gloves. They also would like you to wear eye protection and face protection. It does not have specific disposing properties, but I would tell you, ideally, don't reuse the container it comes in or the bottle that it comes in, and you'll want to dispose of it with it being closed, just because it's better to get in the habit of doing that, since we do have some products that are flammable. So it talks about the composition, and this is purified water and hydrogen peroxide. It gives you your percentages. For first aid measures, it tells you to move them to fresh air and get medical attention immediately if symptoms occur after they've inhaled it. For skin, you want to make sure that you're washing off with soap and plenty of water for at least 15 minutes. Then for eyes, you want to irrigate for at least 15 minutes. And so that's why it's important to have eye wash kits nearby, and also then that helps you get enough time to get over to maybe a sink mounted eye wash kit or a shower for chemical exposures. And now it does talk about some acute and delayed, could be a burning sensation. It can cause serious eye damage and severe skin burns and eye damage as a delayed symptom. It does also talk about your firefighting measures, accidental release measures, just as before. We're going to go over to our exposure controls. It does talk about your permissible exposure limits under OSHA's regulations on the top line. Then it talks about NIOSH as well as another government agency. Then it talks about appropriate engineering controls, meaning having showers and eye wash stations and proper ventilation. It doesn't require you to wear protective equipment for respiratory, but it does want you to wear tight sealing safety goggles and wear protective gloves and protective clothing, ideally long sleeve clothing, and then impervious gloves. It does want you to handle in accordance with good industrial hygiene and safety practices, and then avoid having it contact your skin, etc. We're going to then see that it does have a flash point not available, but initial boiling point is over 100 degrees Celsius. It does show toxicology information as well. It may cause skin redness and redness and tearing of the eyes. It may also cause a blindness and burning. So really, really important that we wear our eye protection as they list in the safety data sheet when we're utilizing this product. No information is available about any type of sensitization or any type of mutagens happening to any of your organs. It does say that for some of the testing, they were not able to find any reproductive toxicity or singular exposure issues or repeated exposure issues. But it does talk about specifically target organs, meaning the respiratory system, your eyes, your skin, your blood, and your lungs. So again, that's why PPE is so important. And a lot of people don't wear PPEs with hydrogen peroxide, just like they don't wear it with the rubbing alcohol. So please take care of yourself and your coworkers and ensure people are following the right policies and procedures. So I'm going to pop on down to number 16, and you can see in this particular one, it does not have additional information about this or any type of the revisions. In some cases, you may see national fire information. You might see, it's called the NFPA. It may have be a diamond. You may also see the HMIS system. So now we'll go over to a instant hand antiseptic hand sanitizer from 3M. It's called Avogard. I see this a lot more in medical offices, hospitals, and surgery centers, but I have seen it a few times in assisted livings and in one jail. So depending on where you're working, you may be exposed to this or a similar product. So I wanted to bring this to your attention as well. So it's based from 3M, which is a Canadian company. So a lot of the items they'll have will be not only the items for America, but also Canada's programs too. So it is a flammable liquid. It does cause serious eye damage because it's a category 2A. And then it has a category 3 for a specific target organ toxicity. The signal word is danger. It is flammable and it has the exclamation mark. It's highly flammable for the liquid and the vapor, and then causes serious eye irritation. May also cause drowsiness and dizziness because it has an alcohol-based product in it that you'll get to see in just a moment. It talks about some prevention, what to do if it's inhaled, to store it in a well ventilated place and keep in a cool area. Also keep the container tightly closed. So you definitely don't want to store this outside in a central area here in Florida. Okay. It talks about its percentage. It does have ethyl alcohol as well as other alcohols. So it's one of the reasons it is so flammable. So be very cautious about that. Talks about your first aid measures. You want to move them to fresh air if they've inhaled it. Immediately flush their eyes if it's had some eye contact. Remove contact lenses. Rinse their mouth if they accidentally swallowed it. There are some firefighting measures. They talk about carbon monoxide and carbon dioxide as well. So this can be used for a dry chemical to put it out. So typical your ABC fire extinguishers typically will be able to handle this for you. It talks about accidental release measures, handling and storage. Number 8 is exposure controls and personal protection. So it talks about use general diluted ventilation and or local exhaust ventilation to control airborne exposures. It does talk about wearing eye and face protection. Under normal use, eye exposure is not expected to be significant enough to require eye protection, but then they do also say safety glasses with side shields. So when I see something along those lines, since it says it's recommended, if I'm going to be using it for more than just one quick use, I would then go ahead and make sure my safety glasses and side shields are put on because that's what the recommendation is. And so it does say that under normal conditions, you do not have to wear respiratory protection, but that if you are going to be having a longer period of exposure, that they do recommend a respirator as part of a full respiratory protection program based on the results of the exposure assessment. And you can use either a half face piece or a full face piece air purifying respirator suitable for organic vapors and particulates. Talks about the fact that it's a liquid, it's going to be white, and it's going to have a slight alcohol odor to it. Talks about if it is reactive or stable, and then goes into our toxicological information. And so it does show that inhaling it gives you respiratory tract irritation. You can have some severe eye irritation. You may have additional health effects if you ingest it. They talk about a single exposure may cause target organ effects for your central nervous system under depression, including headaches, dizziness, drowsiness, incoordination, nausea, slowed reaction time, slurred speech, giddiness, and unconsciousness. So it also talks about not having alcoholic beverages while you're being exposed to this because it could have liver toxicity. That it talks about acute toxicity based on the product and based on the testing it's done and the different species it has done the testing on for the different areas and the skin corrosion, eye damage, etc. We're going to move on over to Purell hand sanitizer. You can see that on the safety data sheet, it does have the maker and it has the date of first issue and then the last issue. You always want to make sure you have the most updated one. One of the things with getting your supplies from Central Supply or your maintenance teams at your host facilities, they should be receiving the most up-to-date safety data sheets. So they should ensure your host facilities ensure that you are always have access to the most recent ones. So this one is made from Gojo, which is an Australia product vendor, I should say. It talks about it's a Category 3 for flammable and can cause serious eye damage. It's got a signal word of a warning with the flam and the exclamation pictograms. And it talks about keeping away from heat and sparks. So you definitely want to keep this one inside in Florida. You want to make sure that you keep your container tightly closed as well, according to this. So we're going to look at our first aid measures. It says, in the case of an accident, if you feel unwell, seek medical advice. When symptoms persist or in case of doubt, seek medical advice. If it's inhaled, move to fresh air. If it's skin contact, wash with water and soap as a precaution. And in eye contact, you want to immediately flush the eyes with plenty of water for at least 15 minutes. And then, of course, remove your contact lenses. Now, remember, this is hand sanitizer. So this is typically in contact with our skin. I would recommend that in areas where it's stored for use, if it is above a person's shoulders, it does need to be relocated to below the shoulders, just based on the precautionary statements in the safety data sheet here. So that way we can minimize the risk of someone getting it in their eyes. We have our firefighting measures, and it talks about a dry chemical. So we could use our ABC fire extinguishers here. It talks about it's not advisable to use a high volume water jet to extinguish. Then it talks about accidental release, just like the other ones do. I'm going to scroll on down to number 8, where we can talk about exposure controls and personal protection. So it's got ethanol in it, and it talks about your permissible, how much exposure you can have, engineering measures, protection. It says use respiratory protection unless adequate local exhaust ventilation is provided or exposed assessment demonstrates that the exposure are within recommended exposure guidelines. So remember, it's a hand sanitizer that we're using, so we want to make sure that we are using it in a well-ventilated area. So as long as the central air conditioning's going, or if we're outside, or if windows are open, making sure that we're getting some ventilation. In surgery centers, as long as there is the ventilation system that kind of vacuums it up, that would be advisable as well. It does talk about wearing impervious gloves, even though it's a hand sanitizer, and they would like you to utilize flame retardant gloves. It talks about wearing eye protective equipment and to select appropriate protective clothing, and then flame retardant anti-static protective clothing. And skin contact must be avoided by using impervious protective clothing. So sometimes it is a little counterintuitive with what this SDS sheet says and what it's used for. So the CDC does tell us, hand washing is better than using the sanitizer. However, perhaps we need to look at a different hand sanitizer versus Purell, since the SDS sheet says we should be wearing personal protective equipment, including gloves with it. It does talk about the appearance and what it should smell like, and the flash points and things along those lines, and if it's stable or reactive. And then I'm going to get to the toxicological information. Exposure routes are inhalation, skin contact, ingestion, and eye contact. And it does say that it's not classified as acute toxicity, but there is an acute toxicity component with the ethyl alcohol. And so you do want to pay attention to that as well. And that there is an acute inhalation toxicity. So be very cautious with those items as well. And then our last one we're going to review, a lot of us are seeing this more and more in our workplaces because of wounds and people needing stitches, but sometimes it's in a bad area. Of senior centers, sometimes we find that we can't get the skin back together with stitches, so we have to use tissue adhesive. And so this is one that I've been seeing a large increase from. And so we have this as it's a liquid adhesive. It's similar to like a super glue that's approved for wounds and things along those lines. So it's a hospital grade or a medical grade super glue adhesive for tissue. Okay. And so it is a danger signal word. It's flammable. It has the exclamation. It may cause an allergic skin reaction. It definitely causes serious eye irritation. They want you to keep it away from heat and sparks and hot surfaces. So don't store it outside, especially in Florida. They want you to only use it in a well-ventilated area, and they would like you to wear protective gloves, protective clothing, and eye protection and face protection, and avoid breathing in the vapors. So we see here that it has ethanol, which is, as we know, an alcohol, because we've seen it in a few of the other products that we reviewed today as common items. It also talks about our first aid in general, never give anything by mouth, allow a victim to breathe fresh air, rinse the skin with water in the shower and immediately take off any contaminated clothing. Rinse immediately if it's got it in the eyes, and obtain medical attention if blinking or redness persist with pain. If you ingest it, make sure they're rinsing out the mouth and do not induce the vomiting. Now, they do have some acute and delayed symptoms. After inhalation, it may cause drowsiness or dizziness. It can cause skin irritation. It can cause an eye irritation. And there is a risk of aspiration pneumonia. And it could also be fatal if swallowed and entering the airways. So this is one that we really need to be cautious with as well. It talks about your firefighting measures, accidental release, handling and storage. It even says to handle empty containers with care because residual vapors are flammable. So we talked about making sure we don't reuse containers sometimes and really closing them up all the way. For Section 8, it wants you to avoid all unnecessary exposure, wear gloves, protective clothing, goggles, and safety glasses. Chemically resistant protective gloves, chemical goggles or safety goggles, suitable protective clothing, wear the appropriate mask, wear respiratory protection, and do not eat, drink, or smoke during use. This particular one is a liquid with a light green color. I've seen some that have a yellow color, and this one has a strong aromatic or balsamic odor. Other ones have a sweeter smell, so please make sure you are checking the SDSs for the products you are seeing. Don't just go based on, oh, it's one adhesive that we saw in this training. It's got to be the same, because unfortunately they're not always the same. And then we're going to go over into section 14, where you'll see a diamond about the medium danger for a flammable liquid. And then I want to bring you down to section 16 and talk to you that sometimes you'll see the NFPA, health hazard, fire hazards, and reactivity, the diamonds. So you'll need this if you're utilizing a secondary label. If you're going to have either the NFPA version or the HMIS, it's going to be the same colors. So health hazard is blue, flammable or fire hazard is red, and then reactivity is going to be yellow. And so you will have your different classes based on the specific product. So when you're filling out your secondary label, sometimes it'll be listed in print, like you'll see here, more towards the center. And then on the right-hand side, you will see that it has the diamond. All right, well, that wraps up our training on the common chemicals that we're exposed to in the healthcare setting, how to read an SDS sheet, kind of covering the general overview for the HAZCOM system and the global harmonizing system. If you have any questions, please contact your supervisor or your host facility and ask the questions for the products there. Make sure you know where the SDSs are located in all of your locations. And if they are going to bring any new chemicals in, they do need to provide you training on that. Thank you so much for your time. I hope you have a great rest of your day.